I really think that the COVID-19 pandemic really pulled back the curtain and exposed many underlying inequalities in healthcare, along with just how fragile our public health structures really are. We've seen higher rates of COVID-19 infections and deaths among our communities of color. And this is really due to the health and economic disparities that we have in our country. And these are not new disparities, these are disparities we've seen for decades. So I think the one thing to understand and to really know is that this is a consequence of underinvestment in public health and health education initiatives, as funding for public health is less than 3% of the nation's total medical cost. I think currently the most important public health finding is that our vaccination programs have saved lives. And so COVID-19 vaccines are effective at either preventing sickness or lessening severe symptoms, hospitalizations, and death. And in my opinion, 2 years into this COVID-19 pandemic, that is still the most important message that we can send to our communities. And moreover, the pandemic has demonstrated just how dangerous misinformation has been to our communities. It's really led to mass confusion about the vaccination program. Other than vaccinations work, we've seen evaluation data to support that public health interventions have been very beneficial in fighting respiratory infections that are transmitted through contact. And data has shown that the universal lockdowns in countries such as Australia and New Zealand have been really successful in substantially reducing mortality rate. However, we know here in the United States that those types of lockdown programs just aren't sustainable. Therefore, I think a message to note is that it's been very challenging to have a fragmented public health response that we've seen throughout the past 2 years in the pandemic. So I'm currently a professor at the University of Alabama in the Department of Health Science. And in terms of my job, we've learned how to transition effectively to the virtual environment. And we've been able to continue to provide high quality teaching and even conduct our research activities virtually throughout the past few years. And I would just say that, in terms of academicians and what we have facing us in the future, my biggest concern is the long term mental health damage that our students might endure that we don't really even understand yet because of COVID-19. And so, academicians like myself will most definitely see these impacts in years to come. The National Academy of Medicine's publication on public health COVID-19 impact assessment. This assessment really focuses on lessons learned and compelling needs moving forward in the future. This is by Dr. Karen DeSalvo and her colleagues. And I really think this article does a great job of examining public health sector's capacity in responding to the pandemic, the many challenges that were faced in doing so, and the contributions of public health moving forward. In addition, the article speaks specifically to the need to better fund public health infrastructure to be better prepared should we face the pandemic or another pandemic in the future. I will also speak to publication in my field of health education. My doctorate is in health education. And so we train students here at the University of Alabama, specifically in health education and promotion. And there's one article in the American Journal of Health Education that highlights the work that health education specialists have been doing on the front lines of the COVID-19 pandemic. And I really want to speak to this because even with this fragmented health response that we've had, our public health response, and the underfunding of the field, we have seen a field of health education and public health educators shift their entire job roles to addressing the pandemic. And specifically, this article provides a snapshot of the work that these specialists are doing in the field and the settings that they're working in, from school health all the way to governmental agencies. And these COVID-19 activities that are documented in this publication show that the work that our certified health education specialists have been doing linked to all the areas of responsibility in the field of health education and promotion. So truly, it's remarkable work being done by our public health education specialists and workers in the field with very limited resources to do so. And so many public health and health education professionals went beyond routine responsibilities to try to meet our public health needs during this time. I think COVID-19 will potentially have long-lasting effects on the physical and mental health of our populations, which public health professionals and scholars will be impacted by in the work that we do in the future. And I think, moreover, the magnification of America's health inequities by COVID-19 will hopefully actually motivate change in the public health infrastructure for addressing these not new issues with more meaningful long-term changes through more resources allocated for public health infrastructure, for training public health workforce, and for true systems change to address these issues. I think so much has not gone well during this time, but I think it's due to delayed responses, not having a unified national strategy, and really misleading statements that happened at the beginning of the pandemic that resulted in a very fragmented public health response. And that fragmented response raised questions among the public about the legitimacy of the work that we do in the field. However, I think it's really important to understand that those structural shortcomings of the field did not happen because of COVID-19. It happened because of years of underinvestment in public health and health education. So that's what we've gotten wrong. And that's honestly what needs to be fixed moving forward. And so I honestly suggest that everyone read the National Academy of Medicine's article that I referenced previously. The authors really do highlight um, the information related to these funding shortfalls, how that produced the response that we saw related to the COVID-19 pandemic. And the article does a great job of providing priority actions and policy considerations for public health moving forward.